There have been a few fear-inspired notions encompassing taking the COVID-19 vaccines even before they were found. The vast majority of those paranoid ideas were a result of strict and social elements, just as through and through counterfeit news. Since the vaccines have been made accessible in many nations, there have been worries in certain quarters regarding the viability of the antibodies, especially the Oxford-AstraZeneca vaccine, whose utilization was suspended by certain nations as of late because of assumed instances of blood coagulating after use. There is, be that as it may, no motivation to be apprehensive. The instances of blood coagulating recorded were insignificant. In addition, clinical preliminaries directed by the European Medicines Agency and the United States have discovered the antibody to be protected and powerful, offering total security against the most noticeably awful results from COVID-19 while causing no genuine results. The vaccine is even now being utilized again by nations that previously suspended it. Indeed, every one of the antibodies affirmed for use internationally have been tried and trusted on the grounds that, like different medications, the COVID-19 vaccines went through numerous periods of thorough testing, investigation, and audit. The clinical preliminaries for the COVID-19 selected definitely a greater number of members than other vaccine preliminaries. Additionally, offices, for example, the U.S. Food and Drug Administration intently screens the antibody advancement cycle and testing results for viability and well-being. As a component of the FDA's conventional cycle to decide whether the antibody is affirmed for public use, it additionally looks for a proposal from a multidisciplinary group of specialists comprising of free clinical officials, microbiologists, scientists, biostatisticians, and other well-being specialists. Be that as it may, in the event that you actually have worries about the security and viability of COVID-19 vaccines and among those inclination reluctant about getting a COVID-19 antibody, underneath are 10 reasons why you ought to consider getting inoculated. 1. To help stop the pandemic as indicated by the U.S. Centers for Disease Control and Prevention, wearing face veils and social removing help lessen your opportunity of being presented to the COVID or spreading it to other people, however these actions are adequately not. Vaccines will work with your resistant framework so it will be prepared to battle the infection in the event that you are uncovered, the CDC says on its site. The office expresses that the blend of getting inoculated and following COVID-19 well-being conventions offers the best security from COVID-19. Halting a pandemic requires utilizing every one of the instruments accessible, the CDC says. 2. It helps from getting the infection. Coronavirus vaccines were assessed in clinical preliminaries and have been endorsed in light of the fact that the investigations show that the antibodies essentially decrease the likelihood of getting the infection. In light of what has been demonstrated about vaccines for different illnesses, the COVID-19 antibodies may help hold you back from getting genuinely sick, regardless of whether you don't get the infection. Getting immunized additionally may secure individuals around you, especially those at more serious danger for extreme sickness from COVID-19. A teacher of medication at the University of Alabama at Birmingham Division of Infectious Diseases, U.S., Michael Sogg, says the genuine estimation of the vaccine is more effectively recognizable than if the antibody advancement had fizzled. We would have been confronted with a detonating pandemic for which there was seemingly no end in sight, Sogg says. It may keep on consuming the populace for another 2 to 4 years. He adds that the antibody works at a practically exceptional degree of adequacy. 3. Results are typically gentle. Transitory specialists at the University of Colorado Boulder Medical Services, U.S., say recall that results are ordinary, they might be more normal after the subsequent portion, and show that your invulnerable framework is developing security against the infection. In any case, numerous individuals don't encounter results after vaccine. Be that as it may, in the event that you do encounter results, they are normally gentle and disappear inside a couple of days. Normal antibody results incorporate agony or growing at the infusion site, migraine, chills, sluggishness, and fever. 4. The vaccines don't change DNA. One of the paranoid ideas that jumped up is that taking the antibody could change the human DNA. Be that as it may, it is out-and-out counterfeit news. Sogg says these mRNA vaccines offer directions to our phones to make an innocuous piece of what is known as the spike protein. The spike protein is found on the outside of the infection. Coronavirus mRNA never enters the core of the cell, which is the place where DNA, hereditary material, is put away. When the directions are inside your muscle cells, the cells use them to make the protein piece. At that point the cells separate the guidelines and dispose of them, he says. Then, the cell puts the protein piece on its surface. The insusceptible framework detects the protein and starts fabricating a safe reaction and making antibodies to battle the disease. Toward the finish of this cycle, our bodies have figured out how to ensure against future contamination, SOG adds. Professor Martin Michaelis and Dr. Mark Wazes of the School of Biosciences at the University of Kent, United Kingdom, likewise exposed the hypothesis that the vaccines change the DNA. None of the antibodies communicates with our DNA. Henceforth, a control of DNA is actually unthinkable, they say. 5. Antibodies save lives. An associate head, students, School of Biological Sciences, University of Portsmouth, UK, Alessandro Ciani, noticed that things have progressed significantly since Edward Jenner originally inoculated a little fellow against smallpox in 1796. The World Health Organization appraises that vaccine at present forestalls 2 million to 3 million passings consistently. Ciani says, smallpox, which asserted around 300 million lives in the 20th century alone, has been completely killed because of the turn of events and execution of protected and powerful antibodies. For certain individuals today, COVID-19 additionally demonstrates deadly. In case you're at high danger from the illness, getting immunized could save your life. 6. To secure and uphold well-being administrations. An Ibadan, Oyo State, Nigerian-based general well-being master, Dr. Kunle Adedapo, says accepting an antibody implies that you are less inclined to contract irresistible sicknesses on your lifetime. This, thusly, assuages the tension on well-being laborers and the well-being framework. At the point when we soothe the well-being laborers of some pressing factor, they would then be able to commit their endeavors, assets and hardware to assisting patients with non-preventable ailments. So getting inoculated against COVID-19 will help in the very same manner, opening up assets by bringing down case numbers and forestalling further accumulations of different medicines, Adedapo discloses to Saturday Punch. The master likewise expresses that when enough individuals are inoculated against an irresistible sickness, for example, COVID-19, it very well may be viably halted from spreading, on the grounds that there are too couple of individuals to contaminate. He says this is known as group insusceptibility. Arriving at group insusceptibility implies that even the individuals who can't get the vaccine, maybe because of some ailments, are secured, says Adedapo. 7. To set aside time and cash. Ciani of the University of Portsmouth says antibodies have been broadly perceived as perhaps the most time and savvy clinical mediations one can have. Getting an inoculation just requires a couple of moments and is modest, or, for some, individuals, free. Then again, getting an irresistible infection implies stepping away for a while from school or work and conceivably piling up powerful doctor's visit expenses, he says. 8. To restrict drug opposition. Antimicrobial opposition has been distinguished by the WHO as one of the 10 biggest dangers to worldwide well-being, as has antibody aversion. The consistent abuse of antimicrobial and antiviral medications causes microorganisms and infections to get impervious to them, bringing about untreatable diseases spreading. By keeping us from getting contaminated in any case, inoculations permit us to lessen our utilization of anti-infection agents and antivirals, in this manner restricting the revolt of medication-safe strains of microscopic organisms and infections. 9. To re-establish society to typical who isn't worn out on lockdowns and limitations. Everybody most likely is. Be that as it may, for these actions to be lifted and for society to get back to business as usual, it is imperative to get immunized to forestall spreading the infection when we completely begin interfacing with each other once more. As per clinical specialists, an vaccine is the awesome best way to get back to life as ordinary, or nearer to what it was before COVID-19. While it will require some investment to carry out antibodies to everybody all around the world, each individual inoculated is a positive development, even as individuals keep on after the security safeguards. Furthermore, Ciani says another advantage getting the COVID-19 antibody offers is to have the option to travel securely. He says, heading out to different nations opens you to microbes your invulnerable framework is curious about with. By accepting the vaccine suggested for your objective, you'll have the option to make the most of your vacation without this gambling a crisis visit to a neighborhood emergency clinic or bringing back undesirable bugs. In like manner, staying up with the latest with your suggested inoculation plan secures the occupants of your vacation location from any contaminations you may somehow or another convey with you. Therefore, COVID-19 vaccines could get obligatory for movement as they are carried out. 10. To ensure people in the future. Siani says that throughout history, mankind has needed to coincide with many crippling and perilous illnesses that are currently uncommon on account of youth inoculation programs. He says, notwithstanding, the pandemic gives an emotional illustration of the overwhelming worldwide impact that a solitary illness can have without an antibody. Vaccinating ourselves and our youngsters against irresistible sicknesses today is an important blessing to people in the future. Stifling infections in the present will allow people in the future to live longer and healthier lives. To help stay safe and protected from COVID-19, subscribe to this channel and click on the notification icon so that YouTube can notify whenever we publish a new video like this one. Thanks for watching.